Have you ever wondered why your hair is thinning or maybe why your skin doesn't look the way it used to? Did you know that problems with your thyroid can cause several changes to your appearance? If you'd like to learn more, stay with me, and we're going to discuss the surprising ways that hypothyroidism affects how you look and feel.
Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started.
Welcome back to another episode of the Hashimoto's Doctor Podcast. I'm your host, Brad Shook, and today we're going to dive into the world of hypothyroidism and its impact on our appearance. And it's not just about the numbers on the scale, because most people will often associate hypothyroidism with a very common symptom of weight gain and how that changes appearance. But this is about our skin and the strength of our nails, the volume of our hair, and some really important changes that you may not associate with hypothyroidism. These can be real clues that there's still something going on with your thyroid, and a lot of people will experience these issues when they're taking thyroid hormone replacement and they don't realize that there's still some work that can be done and that needs to be done to really optimize their health and give them the best chance to, minimize some of the negative consequences of a low thyroid, which is most commonly caused by an autoimmune process, Hashimoto's. So let's jump in and unravel this mystery together. Before we get into this episode, I just want to take a second to acknowledge the fact that I sound like my nose is plugged. And it kind of is. I'm still getting over this respiratory infection that my daughter brought home, and that's cool. I feel okay. I just sound terrible. So please forgive me. Hopefully you can tolerate the podcast and make it through without turning it off. Hopefully the information's helpful and the audio's not that terrible, but it does make it kind of difficult to record these. So just want to acknowledge that in advance and let you know that hopefully the forthcoming podcast will sound better. So let's go ahead and talk about how hypothyroidism affects appearance. And let me just lay some groundwork here. As I just mentioned, the number one cause of a low thyroid is an autoimmune condition called Hashimoto's. And Hashimoto's affects at least 9 out of 10 people that have a low thyroid. So, you're really talking about a staggering number of people. 9 out of 10 people with a low thyroid have it because of Hashimoto's. And basically, your immune system, in these cases, the immune system is attacking the thyroid, destroying the thyroid so it doesn't have the capacity to make enough thyroid hormone. And this creates all kinds of problems, not just because the thyroid hormone is eventually becomes the thyroid cannot keep up with the body's demand for thyroid hormone and you become hypothyroid or low thyroid, but also because this autoimmune process creates inflammation, which disrupts a number of physiological processes. It really wreaks havoc throughout the body, throughout other physiological processes, crosses the blood-brain barrier, creates problems with brain fog. And then the autoimmune process, too, can expand to other tissues. So this is not something that we can ignore. You really need to be aware of this. And I like to highlight this fact because sometimes it's when you find out typically that some of the symptoms that you present to your doctor because you're fatigued or you're gaining weight or a combination of those things, and the doctor will often check the thyroid and then they'll say, hey, you've got hypothyroidism and you need to take this medication. And most people are like, okay, thank God they found out the cause or they found out the reason. And the reality is that's not the root cause of the problem. The thyroid is just getting destroyed by the immune system. And if you didn't have the immune system problem, you would not have the thyroid problem. Okay, so that's really key to understand. If you did not have the immune system problem, you would not have the thyroid problem. So as we talk about the thyroid and hypothyroidism, you always have to keep in mind that one of the primary strategies for a low thyroid, in most cases, right, at least 9 out of 10 cases, is going to be not only to make sure that you're supporting the thyroid levels in the body so that you're not hypothyroid, but it's also addressing the triggers and drivers of the autoimmune process, working to dampen it so that you can decrease the inflammation, change, you will make massive changes throughout the body and the body's biochemistry if you can dampen the autoimmune process. And you definitely can. In most cases, you can make some really significant changes with dietary, lifestyle, and some targeted supplementation for supporting the body's physiological processes. So I just want to kind of make sure that we always start by framing this problem appropriately and don't just talk about hypothyroidism as if a low thyroid is the only issue here. The reality is it's an immune system problem, and that's the issue, the primary issue. And then making sure that you don't have a low thyroid is obviously critical because that's very important too. But when it comes to how low thyroid states affect your body, I mean, there are many different ways that this occurs, and it's not just that you have low energy, but it has this really profound impact on your physical appearance. And again, it's like the skin and hair and nails and even your joints, and this inflammation that's associated with this process really creates a lot of problems for our health and for our appearance, and so it's how we look and how we feel. It's really a very significant and profound issue. But to really truly address these symptoms, you really have to understand this root cause. And it's not just about these thyroid hormones. It's really about managing this underlying autoimmune condition and doing it as effectively as you possibly can. So let's dive deeper into some of these specific symptoms that we're referring to here with how hypothyroidism can affect your appearance. And so the first thing, and probably one of the most common questions that I get asked about, secondary to body weight. I mean, body weight and usually it's an inability to lose weight is the number one thing that gets brought up, that and fatigue. But as it relates to appearance, I would say the second most common thing is hair loss. And this is a really a hypothyroidism, and the autoimmune process can have an impact on hair and hair growth or hair loss several different ways. So I want to touch on a few of these to give you the highest, what I think are like the highest probability causes for hair loss. Okay, so one of the primary reasons that you'll lose hair with hypothyroidism is that the metabolic rate of the hair follicles is impacted. So and this leads to hair loss. So you don't have the capacity to grow hair at the same rate because the thyroid hormone literally stimulates every cell in the body, including the hair follicle. And if it's not getting proper stimulation, then you're not going to have hair growth. And this can create a lot of problems for the health of the follicle. But it's not just about the thyroid hormones. That's one of the main things that we obviously want to touch on, that because it is relevant here. But it's also about chronic inflammation and poor blood flow. And this is and even like secondary autoimmune diseases like phospholipid autoimmunity, which can cause you to lose hair as well. But the poor blood flow is something that's really common as well. If you have cold hands and cold feet, if the tip of your nose is cold, then you're definitely not getting blood flow perfusion to your scalp. And your hair and the hair follicles require vitamins and minerals and oxygen and hormones to nourish the cells of the follicles so that hair can grow. And so this is one of the the major problems that you see with hypothyroidism is this decreased blood perfusion to the extremities. And this creates all kinds of problems, and your hair is one of those. So that's something to absolutely keep in mind, and then also this autoimmune expansion. Okay, so that's one of the first things that we'll see with appearance. One of the next things that's pretty common that there are issues with are nails, fingernails and toenails. So if you've noticed that you have weak nails or they're soft, and especially if you're noticing like that you're prone to fungal infections, then hypothyroidism might be the cause of that. And adequate thyroid hormones are definitely essential for some of the things we've talked about can come into play here, like blood flow, but also for collagen production. And collagen production is required for the production of your nails and your hair. So you have to have the proper metabolic rate, so the thyroid hormone quantity. But then this really comes back again to blood flow. So if you don't have good blood flow and you're not getting delivery of nutrients to the nail beds, then for one thing, if you get like exposed to a fungus, then and you have a fungus that starts to colonize your nail bed, and you can't get rid of like say a toe fungus, then it's not just about keeping the feet dry. It's also that you may not have good blood flow, and because you don't have good blood flow to the toe or to typically the toes, then you don't get good white blood cell delivery to the toes. And then you cannot fight off infections, and you can't heal like you should. So this can create problems with the nails, but also problems with like fungal infections. Okay, the third thing, and which is actually the most common thing I touched on earlier, is or I should say, are these weight issues that occur. And while we know that weight gain is a common symptom, some people might be surprised that difficulty gaining weight and building muscle are also connected here, because issues like malabsorption, for example, poor absorption of your vitamins, minerals, your proteins, your amino acids, and inability to really efficiently digest your protein, that could be caused by hypothyroidism, that is ultimately leading to gut inflammation or dysbiosis, bacterial imbalance, and that's usually coupled with or combined with constipation. So these physiological changes that we see throughout the body, they have many different consequences and cascades of problems that can occur as a result. So, weight issues are probably the most common symptom that people present to work with my clinic with. They have weight issues and fatigue are like right at the very top of reasons that they want to try to figure out how to support their Hashimoto's and autoimmunity, because they want to try and optimize their physiology to change those things. So another thing are changes to your skin. And have you heard of like the peaches and cream skin? This is something that's pretty common with hypothyroidism, and you often see with hypothyroidism issues like rosacea, and you can see eczema occurring, and even psoriasis. They tend to be more common when someone has they're in a hypothyroid state. And I think again, there's a cascade of problems that occur, right? So what might be the mechanism that someone develops rosacea or psoriasis from hypothyroidism? Well, it's very commonly linked to poor GI tract motility and clearance of your stool. So you're constipated. The stool has a longer transit time. Your body doesn't eliminate as efficiently as it should, and then that creates bacterial imbalance in the gut or dysbiosis. It creates inflammation. It puts stress on the immune system through the bacterial imbalances. It can create stressors for your liver. And all of these things combined can really set the stage for increased intestinal permeability and just really poor detoxification pathways. It's why, like with a lot of people that have issues with psoriasis and rosacea and eczema, one of the things that you'll commonly see is there are issues with their digestion, and they usually need liver support, pretty significant liver support. And typically this is like phase 2 liver support. So if you look at the biotransformation pathways, the liver, phase 1 and phase 2, usually phase 2 is where there needs to be support. And so that in combination, I mean, you try to assess the situation as a practitioner, and you try to put together a strategy that's going to address as many things at one time as possible without it being overwhelming, right? With it being doable. So it just depends on how someone presents, like what you might choose to focus on as far as a clinical strategy. So skin conditions, absolutely common changes in the skin. The next thing that you commonly see are issues with the joints, which it's it's not as much as appearance here, but joint pain is definitely something that that you can see, and it can lead to issues with joint pain and swelling, and you will see autoimmune conditions in groups. Most of the time, the people that I work with that have Hashimoto's, they only have a diagnosis of Hashimoto's, but some people have Hashimoto's and they have rheumatoid arthritis, and they have or they have another autoimmune condition like pernicious anemia, or like an inflammatory gastritis, which is a lot of times autoimmune, or they're just any number of the autoimmune conditions that come together. So you will see people that have joint issues pretty commonly too, and this can be due to like expanded autoimmunity, another autoimmune condition, or it can just be the consequence of the hypothyroidism and the autoimmune process with Hashimoto's. And then I will say that kind of a symptom that's a GI symptom, but also can be with your appearance. It can affect your appearance, is puffiness and bloating. And so, if you're bloated, you sometimes will look and your abdomen will be distended. And people very commonly have told me very dramatically that they notice differences in their abdomen, sometimes after they eat certain things. And so for sure, this is very common with Hashimoto's is puffiness and bloating, and with hypothyroidism. And this can be associated with a few different mechanisms that you commonly see with Hashimoto's, but the systemic inflammation and how that changes your physiology. And you can see facial swelling in people that have Hashimoto's. You will see water retention. You'll see abdominal bloating. Some people that are really, that have significant hypothyroidism will develop a condition called myxedema. And these are all, very significant, and they make your life miserable. So these are probably, I would say, those are the most common things that I see clinically as far as how your appearance can be and is commonly affected with hypothyroidism. So understanding these things and then kind of thinking about yourself and like, okay, am I dealing with any of these? Are these affecting me? It's the first step towards addressing them, because just being, acknowledging them and becoming aware of them is the first step. Okay, so the next thing is, what can you actually do about this? How can you improve it and turn some of these changes in your appearance and whatnot? How can you turn those things around and make a difference? So the first thing I would say is, if you're hypothyroid, talk to your doctor and get a thyroid replacement hormone, because this is something that is absolutely critical. Every single cell in your body depends on thyroid hormone. If you have low thyroid hormone, you're going to age at an accelerated rate. Okay, because every single cell in your body is dependent upon this. And for your cells to carry out their physiology, whether it's the liver and detoxification, or the intestines and healing the lining, or your skin, or your hair, or your nails, they're all dependent on thyroid hormone for the production of energy so that they can carry out their normal physiological processes. Your immune system cells are dependent upon thyroid hormone to produce energy and function normally. If you are deficient, you are going to age rapidly, and I have never seen anyone significantly improve their health that refused to take a thyroid replacement hormone when they are hypothyroid. I mean, it's literally you're depriving yourself of a hormone that is essential for life. I mean, so it's really critical. Okay, so that's one thing. And I've worked with people that I get that you don't want to start a medication because it's something that you'll probably have to take for the rest of your life. But I can just tell you that I hear you, and I would love if there was a way to help people reverse hypothyroidism without taking a replacement hormone. Then I would be, I would mention it every time I had a podcast, every time I talked. I would be, teaching people and sharing this information. But as it is today, there's no way to to change these things. I mean, there are some cases where that I'm aware of where, after giving birth, there is postpartum, there can be hypothyroidism. And I've seen those cases be transient where it was something that was associated with birth, childbirth, and it improved after a period of time. I've also seen those cases persist where it was kind of a trigger for Hashimoto's, and then there was a persistent autoimmune process that continued and created problems forever. But the key here is, don't walk around and don't continue to be hypothyroid, because it's going to just create all kinds of problems for your health. Okay, get that out of the way. The next thing to consider is that 90% of these cases, hypothyroid cases, are caused by Hashimoto's. So find out if you have Hashimoto's. Get thyroid antibodies tested. TPO antibodies, which is thyroid peroxidase, and thyroglobulin antibodies. Thyroglobulin and TPO, these are both found inside the cells of the thyroid, and they are the primary targets for the immune system if you have Hashimoto's. So if you have antibodies against those, then it is a very good indication that you have Hashimoto's. And I mean, they can be associated with other things, but most commonly it is Hashimoto's. So find out if you have this autoimmune process. And if you have the autoimmune process, then, and most people do, so we're going to talk a lot about how you want to consider supporting the autoimmune process. If you're autoimmune, then you need to consider either a trial and error based approach using dietary strategies, lifestyle strategies, and then some temporary nutritional supplementation, or you want to get detailed testing to help you assess your immune system to see what you are reacting immunologically to, what food proteins, what pathogens, what chemicals. And then you also want to consider assessing your barrier systems, your intestinal barrier, your blood-brain barrier. And then I would want to consider looking at some very core biomarkers. Definitely like a complete blood count, CBC with differential, red blood cells, white blood cells, and probably an iron panel. You would want to look at your lipids, your enzymes, typically referred to as like liver enzymes, vitamin D levels, vitamin and mineral status. I would definitely look at those if you can. Possibly some other testing as well, but if you have in your budget, any degree of that testing can help to give you a better starting point. And that can help you to better tailor the dietary strategy, the lifestyle strategy, and then the supplementation. And it can also give you some, inflammatory markers, thyroid markers, all those things as a baseline, as a starting point that you can then pick from those tests and reevaluate periodically, let's say after 3 months and maybe 6 months. And you can use that to track physiologically how your body's changing, and also, of course, you're tracking like how you feel and how you're functioning, how those things are changing. But you have some quantitative data, some biomarkers to give you guidance in the beginning, and then also to track changes and progress. So that's a great way to do it if you have a budget for those things. If you don't have a budget to do testing, then what I would recommend considering then is a dietary strategy. Now, in my practice, what we typically find is that like an anti-inflammatory diet can really help significantly to manage some of these symptoms. And that is basically specific diet, you could call it an elimination style of diet. I mean, there's all kinds of different elimination diets. I mean, taking out gluten by itself, that's an elimination diet of gluten. But then there are also diets where you basically, you take out almost everything and you only eat very few foods, and that's also an elimination diet. So there's different types of elimination diets, obviously. But what we've seen is that an anti-inflammatory diet that removes foods like typically, and this is temporary. This is a temporary intervention to see how foods are impacting you. And so things like nightshades, removing gluten, removing dairy, these are things that might aggravate the autoimmune process, create intestinal inflammation, and can be really problematic for a lot of people that have Hashimoto's. I mean, those are like some of the basic things. I mean, as a template, like a diet, like an autoimmune paleo style diet can be very helpful. I'll often use a dietary strategy that we've put together in our office to, as a framework for people, and that can be beneficial. So dietarily, a short-term intervention to see how food is impacting your health. Now, you always want to consider things like, and everything is connected. So, I could go on and on about how one thing connects to the next and can lead to the next, but just to keep it simple enough, dietary changes can be really helpful, like those I just mentioned. The next thing, considering lifestyle factors. So lifestyle, if there's one thing from lifestyle that I would recommend, it is sleep optimization, period. That's it. If you could only focus on one thing, like there's no exercise, there's no anything else, sleep optimization. Now, to optimize your sleep, oftentimes you have to consider a bunch of other factors in your day-to-day, like your stress levels and like your physical activity levels, and going to sleep and waking up at the same time every day, even on the weekends, can be really helpful in training your physiology, getting you a rhythm set so that your body anticipates sleep, and so that it becomes efficient at the timing of production of melatonin, and when you wake up in the morning, the spike in cortisol that naturally occurs, and doing things to optimize sleep. A lot of the basic things that you might be familiar with, a lot of people are, but like, keeping your room cool, like typically a target of about 68 degrees or even cooler for some people is really helpful. Making sure that there's the most, that you eliminate as much light in your room as possible is very, very helpful, very important. Having a nighttime routine where you wind down instead of, being stimulated, one way or the other. Like just me personally, one of the things that can be kind of challenging is that when my kids are going to bed, if they argue about the bathroom or anything, they become, it seems like, irritable, and it's a point of potential conflict that can be common. Trying to head off some of those things, put in place strategies that help to reduce those friction points can be really helpful. So stress is definitely not good because it raises cortisol, your stress hormone cortisol, and that will inhibit and decrease your body's ability and timing of the release of melatonin, which is essential for you to be able to go to sleep. It's essential for a lot of other physiological functions, and it's beneficial for your body. So you want to be able to produce melatonin when you need it. And so setting a routine and keeping things dark, minimizing a lot of light exposure the last few hours before bed, not eating within 3 hours of bedtime. These are like some of the high points that I can mention to you that can be really helpful and effective. And then tracking your sleep is incredibly helpful, whether it's a smartwatch or a smart ring or using an app like Sleep Cycle. Those are all fantastic ways to track and monitor your sleep, because if you have sleep apnea or if you're snoring or any of those issues, you need to address those problems. And there's no other way to say it. It is like sleep may be more important than diet. I'm not exaggerating. There's so many physiological changes that occur at night, and your immune system is so dependent upon deep sleep that I cannot really emphasize it enough. And it used to not be the cornerstone thing that I thought was like kind of like the keystone of autoimmunity. I thought it was always really more diet. And diet's incredibly important, and it's different for everyone. That's also the other thing. Everyone has this bio-individuality of their autoimmune process and of their thyroid issues. So, everyone has their own primary drivers, but sleep is critical. So from a lifestyle perspective, optimizing sleep is number one, and then stress management is going to be like the second thing. And there's a lot of things. If you're just aware that stress is a problem and for sleep and for your health. And then you think about that and you say, okay, well, what is stressful? Just the exercise of actually asking yourself and trying to identify points of stress is very helpful, because a lot of people know they're stressed, but they don't really think about why. So if you're stressed, or you should go through this exercise and just try to identify the points of stress, and then do everything that you can to minimize them, remove them. Do things like stretching or yoga or walking. Going outside and walking is fantastic for stress relief, even if it's a short walk, like 5 or 10 minutes. That's a great thing to do a few times a day if you can. It just really helps to reduce your stress and can help you significantly. So minimizing stress, optimizing sleep, eating the right type of diet, those are all things that can be really helpful. And I want to say something. Exercise is really important too, because it helps with increasing blood flow perfusion to the extremities. Remember, we talked about how with hair and cold hands, cold feet, cold tip of the nose. Well, a lot of people that have hypothyroidism have poor circulation and blood flow to the extremities. Exercise helps to get your blood moving and helps to improve your distribution and perfusion, or getting blood to the extremities and to your scalp and everywhere that you need it, to the toes and the nail beds. It helps significantly. So it can be a really helpful thing to do. And it doesn't have to be, high intensity interval training. It can be, more relaxed and moderate or really easy exercise, just like walking, if you can do that. So those can be really helpful. And then from a nutritional supplementation perspective, there are a lot of different supplements out there that can be really helpful. There are several, but what I would say is that for most people, a great place to start, you really want to try to work with someone that can help you tailor a supplementation protocol based on what is actually happening with you, rather than just take this shotgun approach and just try to do everything that you possibly that you can, take a bunch of supplements. Because once you get over 6 supplements or so, I tend to start asking myself, are we on the right track here, or is this overkill? And a lot of times I'll start with people, I won't do any supplementation, none. It'll just all be food. Though, it just depends on the individual. But so if there is supplementation, if we are going to recommend supplementation, it's usually, making sure that vitamin D is supported properly. And that's why testing, you really should test your vitamin D to see where it's at, because it is so critical. If there was just one supplement, it would be vitamin D for most people, because it is so intimately tied to your immune system and to how your immune system functions, that I would focus on vitamin D. But so let's just say some generic, I would say standard, not generic, but standard, more of foundational protocols would be vitamin D supplementation, essential fatty acid supplementation, typically like an omega-3 fatty acid, like a cod liver oil, or an algae-based omega-3 fatty acid. If you don't want an animal-based source, then let's see, probably a multivitamin. But when I say multivitamin, it needs to be immune system neutral, not have anything in it that's going to really stimulate the immune response. And this is like really just more vitamins, minerals, and some of the fat soluble vitamins A, D, E, and K are the primary things that I like to see there. And then we went further, typically people need some kind of GI support. Not everyone that has an autoimmune condition or Hashimoto's has a digestive tract issue, but a lot of people do, the majority. So, usually it's something beyond that to support the gut, and or something like glutathione, like a liposomal glutathione, which is an antioxidant. It's very helpful for immune system regulation, for supporting phase 2 detoxification pathways of the liver, which we touched on a little bit earlier. It just has a lot of potential benefit. Either that or N-acetylcysteine. Sometimes I'll give a supplement that combines N-acetylcysteine with liposomal glutathione, and then another form of glutathione that's highly absorbable called S-acetyl glutathione. Those can be really helpful. And so maybe that, and then, it just depends on the individual, but probably something to support the gut lining. And then maybe a combination of probiotics, or maybe I just recommend like a fermented foods. Again, depends on the individual, how they do with those. A lot of individualized factors, but maybe some bacteria support, some probiotic support. Just really depends on the individual from there. But so those would be the things that I would consider focusing on more, right? Diet, lifestyle, and then some supplementation, just to support the body so that it is better able to carry out your normal, everyday, essential physiological processes. That's kind of where I think I would begin. So, I think that's probably a good place to stop with our recommendations. I mean, the key thing here is, if you're autoimmune, you really need to address and try to manage that autoimmune process. Because if you don't, you're going to have, you could remove triggers. I mean, that's one of the keys, is identifying and removing triggers, immunological triggers. So partially digested food proteins or peptides, that's what they would call like food sensitivities, is really important. If you're reacting to foods, every time you eat those, they could be driving the inflammatory response, driving the immune response, and really contributing to autoimmunity and creating inflammation. So it's very difficult to heal if you're constantly stimulating the immune system and driving the autoimmune process. And so looking for triggers, again, foods, pathogens, chemicals, and some of the testing and things that I mentioned, that's kind of a general framework. But anything that's triggering the immune response, if you can remove that, you're going to have a better chance of calming the immune response and dampening the inflammatory process. And that's huge. And sometimes that can be a massive game changer for people. So you really need to focus on managing the autoimmune process if you're autoimmune. If you're not doing that, I mean, it can be done and it doesn't have to be overly complicated. But if you're not doing that, you're missing a huge piece of the puzzle. And you could be putting yourself at risk for further progression, because it's not like this. The autoimmune process attacking your thyroid, every time the immune system attacks it, it damages the tissue and scars the thyroid. Like literally it's scarring the tissue. And that in and of itself can lead to damage of the DNA, and that can lead to cancers. It is established in the scientific literature that prolonged autoimmunity predisposes you to different types of thyroid cancer. The prolonged thyroid autoimmunity. I have that in one of my articles on the website. I mean, there's a ton of stuff that I have there, but it's absolutely true. And that's one thing that you want to, you should really be focusing on, decreasing the inflammation, because you will have a system-wide improvement in how you feel and function if you can dampen the autoimmune process, remove some of those triggers. Everything's just going to upregulate and be in a better place. So definitely keep that in mind. And just remember that everybody is unique. Everyone has this unique thyroid and autoimmune I call it bio-individuality, right? Their own individual makeup of the things that are triggering and driving their issues. So what works for one person may not work for someone else. It's really about what's finding best for you.
If you found this episode helpful, please share and leave a review. It really helps the podcast. And as always, don't forget to subscribe so you don't miss an episode. You can also follow us on YouTube and Facebook at the Office of Dr. Brad Shook. You can join our Facebook group, the Greater Hickory Thyroid Support Group, with over 11,000 members, and you can find me on Instagram at Dr. Brad Shook. And remember, together, we can make a difference.
Remember, your health is a journey. It's not a destination. So every step that you take towards better understanding and supporting your body will get you closer to regaining your quality of life. So stay curious, continue to learn, and most importantly, stay hopeful. Until next time, everybody, have a great day.
Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.